Moms should never feel less than for choosing formula. That while formula is good and formula is effective and adequate to raise your child and to grow a healthy baby, formula and breastfeeding are just not the same. Breast milk is customized. We are literally afraid to say that breast milk and nursing is actually better. Hey, hey, hey. Welcome back. Welcome back. We're so excited to start another year of incredible discussions and topics. We seem to be in this cycle of wanting to be politically correct or not hurt people's feelings to the detriment of the accuracy of the information that's being shared. So I'm going to expand on that a little bit more. And then I'm going to dive into one of the most common areas of health that we seem to make this ongoing mistake. And I'm going to expand on that. But many of you may have probably already witnessed, read some of the commentaries yourself, and may already be aware of this particular issue. So I'm so excited to go through for the first part of the year. I think we should talk about some of the biggest mistakes I've noticed people make about their health. So I would like to take the time in beginning of the year to make sure we all are set on the right track to talk about each of these topics for the first 4 weeks. Before we jump into the depths of it all, first of all, welcome to those who are on the platform for the first time. You know how it goes. Make sure you click that subscribe button, click, 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 and definitely hit the like, hit the thumbs up, because that's how we get in front of the virtual masses to make sure people are hearing these relevant topics, topics that are brought to you with accuracy and much efforts to make sure that you have the right information. So let's dive into this topic. By the way, I am Dr. T for those who are not familiar with who I am. And I am qualified to talk about these topics because I take care of patients and have done so for decades and try to keep up with the evidence-based information to make sure I share with you the most accurate information we possibly can on this platform. I'm not the only one who does that. I have a whole team of experts who do the same thing and have been in their fields for just as long, if not longer. Okay. There are lots of healthcare workers who are influencers, but looking at the sheer number of healthcare workers, you can definitely see that the far majority of healthcare workers do not want to be on these platforms. And that is not because we don't want to share any information. It's not because they don't think it's important for the public to have accurate information. It's just because people don't want to deal with the negative energy or with the backlash, or with, let's be real, the liability of sharing information, someone coming after you just because they can. So there are real costs to doing things like this. So a perfect example of this is when it comes to breastfeeding. Yes, I'm going to touch on breastfeeding, the one topic. Listen, y'all don't want to talk about breastfeeding when it comes to how we address breastfeeding moms versus those who are using formula. And I don't want to say versus, because honestly, where everybody's out here just trying to make sure their babies are fed. But from this topic's perspective, I'm going to make comparisons just so we have better understanding of why this is an issue and why we need to change the approach when we talk about breastfeeding, when we talk about formula, when we talk about is one better than the other. So here's the thing. I have been noticing for some time now that people are just so hesitant to say that breast milk is better or that nursing is better, that we are literally afraid to say that breast milk and nursing is actually better. Now, hear me out. Let me explain what I mean by this before y'all start throwing the stones. Okay. The reason why I think this is really important is if we are asking moms to make informed decisions, then they ought to be informed. Does that make sense? So when moms are trying to decide, should I breastfeed or should I use formula for whatever their circumstances are, and this can be varied, they ought to have the information necessary to make that decision. And by saying to moms that there is no difference between breastfeeding or nursing and formula, we're lying to moms. But that is not the same as saying that it is okay to feed your child with formula if that is the best selection for your family. And that decision may be based on the needs of a child or based on the mom's need or just based on the needs of the family as a whole. And that is okay. Moms should never feel less than for choosing formula. At the same time, we should not be lying to moms by saying that formula is no different than breastfeeding or nursing, because that is a straight lie. It will never be the same. And let me tell you, can I tell y'all the real on this? I can't find a pediatrician who feels comfortable talking about this topic because it's so polarizing. And in some cases, very risky. And I'll explain why. There's a lot of funding when it comes to formulas, lobbying for certain laws, and a lot of power behind it. There is a hesitancy for pediatricians to come forward to really have this discussion. And unfortunately, you see a lot of pediatricians who are amplifying the message that fed is best. And fed is best. But fed is best is not the equivalent of saying that formula is the same as breast milk, because it's not. So let me go through with you why I say for sure that while formula is good and formula is effective and adequate to raise your child and to grow a healthy baby, formula and breastfeeding are just not the same. And there are nuances to this topic. Let me give you an example. One nuance is the fact that when it comes to mood disorders, one has a benefit and the other also has a benefit. Let me explain. So, for breastfeeding moms, there is the release of the oxytocin, the release of neurotransmitters that help their mood, help with the bonding of the child. Oxytocin, as we know, is your bonding hormone. So, it helps for mom and baby to bond together. Now, there are some neurological benefits for babies to their breastfeeding. There is a positive impact on their neurological development. I'm not going to get into the needy of it all because I'm going to stay in my lane. That's for my other colleagues to talk about. On the other hand, there can be a detriment to breastfeeding. Breastfeeding is hard. It is extremely demanding. It is extremely hard to do. And especially if a mom doesn't have a good support system, it can literally be a negative impact on the mom's mental health. So I have known women who have chosen to breastfeed as an effort to help their mood disorders, and I've also known women who have opted not to breastfeed because of the impact breastfeeding has had on their mood. You see how that's a nuance? Now let's get into the nutrition of it all because that's really important for us to really do a thorough comparison or as much as we can on this platform without doing a full lecture comparison between the two. So one thing we know that breast milk is highly nutritional. So we all know, and I hope if you don't know, please understand you cannot give newborns water. And they don't need the water because breast milk, for example, is about 88% water. So it's highly hydrating for newborns. Breast milk is filled with macronutrients. Babies are getting their fats, they're getting their carbs, they're getting their proteins, but breast milk contains way more than that. They're also getting their vitamins, their A, their C, not a lot of D though. We'll talk about that. That's why D oftentimes has to be supplemented in breastfed babies. They're getting their E, their K, their vitamin Bs, depending on mom's diet and mom's intake. Hopefully, they will also be getting good amount of calcium. Not a lot of iron comes through breast milk. That's another thing to talk about. But they will get their zinc, their potassium, important electrolytes, their sodiums, so forth and so forth, right? Breast milk is a superfood. And it's a superfood because it's more than just vitamins and macronutrients in water. Breast milk contains antibodies. These are the things that you can't get in formula. So those antibodies are what are critical for babies to build their own immunities, to basically get passive immunity, meaning they didn't have to actually have the infection, but they're able to respond to certain bacteria and viruses based on mom's immunity. So they get that passive immunity, which is great. They get living cells, y'all. They get stem cells through breast milk. They are able to get cells that are important for the immune system, white blood cells. They also get hormones. And this is really important because they get their growth hormones, hormones that help them to regulate, to develop, to function better, but also hormones that help them go to bed and to know what time of day it is because they have no conscious awareness of the time of day. We need them to go to bed when it's bedtime. How does that work? Well, this is why it's important for breastfeeding moms who are storing their breast milk to label not just the date, but the time of day. Because your morning milk is filled with steroids that help the baby to know it's daytime. We need you up and active and ready to do some tummy time. And also you get that increase in melatonin as at nighttime. So baby knows, okay, dad and mommy are ready to go to bed. We need you to go down too. And switching that up may affect their internal clock or their ability to be on a particular schedule with you. They also get enzymes through their breast milk and they get all sorts of nutrients. You know, the list is really exhaustive, but I really do want to point to a couple of other components and and also make note of the fact that breast milk also changes depending on the health of the baby. So if a baby's ill, so baby's needs are communicating through that breast to mouth contact that then allows mom's body to receive the information necessary to make the breast milk that is needed for the baby. So breast milk is customized. And it's not just customized for the individual, it's customized for the staging of the individual, the health of the individual. So as the baby grows, the breast milk changes to meet the needs of the growing child. As the baby goes through a growth spurt where you get that cluster feeding that's really hard because the babies are trying to eat every hour, the breast milk adjusts for those growth spurts, right? And so it's really important to understand that the customization of breast milk, though formula does adequately meet the nutritional needs of infants, it is not customized to the individual, to the genetic makeup of the individual, right? Maybe they'll get there one day, and maybe they're working on that now, but as far as we know, it's not on the market yet. So, as of this point of this recording, breast milk and formula do not have the same ingredients, but they're both adequate for a growing infant. Another thing that I do want to make mention of, breast milk also have those microRNAs, which will help with gene expression and development of the child. One of the things we don't spend enough time talking about is the microbiome. That microbiome is really what helps to not just give the baby or help with the gut flora. We know that breast milk is a little bit more gentle on the gut of a child, but it's also creating that healthy bacteria necessary so that the baby can have decreased likelihood of developing certain disorders or diseases. So it has been shown that the healthier the gut microbiome that is produced as a result of breastfeeding moms and their microbiomes, then reduces the likelihood of infants developing certain um, chronic conditions, certain disorders and diseases as they develop and grow older. So that's one thing I definitely do want to emphasize. Some of the things that are less common in babies that are breastfed include asthma, obesity, type 1 diabetes, eczema, childhood leukemia is less common. And here's the thing, SIDS, and this is something that we need to talk about more. If a mom has experienced losing a child because of SIDS, then you would want, if it's okay with the mom and she wants to, really support her in her breastfeeding journey, because that can make the difference in reducing the risk of her subsequent pregnancies and kids, essentially. But here are some other things that we don't talk about when it comes to breastfeeding. So I talked about the nutrition, I talked about the healthy immune system, reduction of disease risk. I mentioned a little bit about cognitive development is better in babies that are breastfed, a better digestive tract. So a lot of that has to do with the child. Let's talk about the mother. This is the part where we don't talk about enough. So remember that oxytocin that I mentioned that's released that helps with bonding? That same oxytocin also helps to contract down the uterus down to its normal size. And that contraction and a cramping that moms feel as they're breastfeeding, especially in the first couple of weeks, is really also important in reducing the amount of blood loss. So that clamping down on those blood vessels in the uterus helps to reduce the bleeding. So breastfed moms will oftentimes have in general, there are certainly nuances to different cases, but in general, they have less bleeding and they have that hormonal aid that helps them to get that uterus to contract down and reduce in size. Also important for moms, especially moms who have known risk factors for cancers. So if someone has a known risk factor for breast cancer or for ovarian cancer, it's important for them to know that part of reducing their risk could be breastfeeding, and not just breastfeeding, but that reduction in their risk is further increased as they breastfeed longer. So that's why these things are so important for moms to know. For a mom who has who is affected by type 2 diabetes, for example, and wants to have the best optimized control of their sugars in the postpartum period, then they should know that breastfeeding aids in that breastfeeding helps to reduce blood pressures for those who are affected by preeclampsia. They may want to know that breastfeeding can help to reduce their blood pressures. They may also want to know that breastfeeding helps to reduce heart disease and osteoporosis. So, if someone has a risk factor for any of these health conditions or may already have a chronic issue, they would want to know this information. And that is what being informed is, to make the best decision for themselves. If there's a mom who, for example, has retained her weight or is already concerned about her excess weight, or perhaps retained her weight from prior pregnancies, it's important that she knows that breastfeeding helps to reduce her weight loss more rapidly. So, breastfeeding moms are more likely to have a more rapid um, are more likely to have adequate postpartum weight loss. Breastfeeding aids in the weight loss after pregnancy. And so it's important to give women that information, especially if there's already an ongoing concern with regards to a particular health condition. Also, I mentioned the bonding and the emotional connection with the child, but breastfeeding also reduces stress. Postpartum is stressful. It is highly stressful. It is exhausting for moms. So, knowing that breastfeeding may have that positive impact, even though breastfeeding is also very demanding, once you kind of get in your routine, you're in your routine and it gets much easier. There are other benefits for those who are thinking finances, who are concerned about the cost of keeping up with formula. There are supportive programs, but as we have all learned, a lot of the safety net programs that help to aid with nutritional resources and filling in the gaps for the underserved populations are vulnerable depending on who's in charge. And so, really making the decision as to whether or not you can financially afford to breastfeed is a critical decision for a lot of families. So, making sure that they know and are able to weigh out the cost and benefits of breastfeeding. Yes, the pumps cost. Yes, the nursing pads cost. Yes, a lot of the accessories cost, but formula is extremely expensive. And for some families, being able to breastfeed may be more cost effective than actually buying formula. For some people, the benefit of formula is the consistency, right? You have your rhythm down, you can make your bottles, you have your routine, um, and you're able to know that the nutrition that the child is getting is adequate. You know what your ingredients are, you know what you're giving your child for the most part. For a lot of people, that is reassuring and they appreciate more that consistency and less of a demand. If mom is sick, it's less of a demand on the family. If mom needs more time to sleep or to recover, it's sometimes much easier to make a formula bottle because even while dad may be on duty and taking care of the infant, for example, during the nighttime, mom, if she wants to keep her supply going, still has to pump. She still has to pump. She still has to wake up and empty her breast so that she doesn't become engorged, so that she can keep the demand of her body so that her body will continue to produce the breast milk. Because if you start to decrease the demand of the milk, meaning you're not pumping enough or you're not feeding the baby enough, then the supply of breast milk is going to reduce. And so even when dad is on duty, mom is still kind of on duty too. And having these realistic conversations is very important. And here's the thing, you guys, we still have to be very mindful of the formula industry. We still have to make sure that we hold them accountable. Even as families choose formula, it's really important that as the public, we hold formula companies accountable. It's so important to know who is lobbying because allegedly, one of the biggest lobbyists for example, maternity leave, against maternity leave specifically, is Nestle. Allegedly, they have been lobbying to make sure that paid maternity leave does not become law. And the reason why is they are one of the biggest producers of formula and are pretty much one of the giants in the formula industry. And so the more women have to go back to work, the less likely they are going to breastfeed, and the more likely they're going to choose formula for convenience. And so they have lobbied against paid maternity leave so that women are more likely to return to the workforce earlier. And we know that still a significant portion of women in the United States return to work as early as 2 weeks postpartum. And 2 weeks postpartum, we know, is not a sufficient amount of time to really build a good breastfeeding habit. For many, it takes a few months to do so. And so, going back to the earlier women go back to work, the less likely they would have developed a good breastfeeding habit or routine with their child, and the more likely they are to switch to formula or just to use formula to begin with. That being said, they have also been accused of not giving equal health nutrition to all skin color and nationality. Let me explain. Not to mention that the same company was found to have baby products that were sold in Africa that had sugar added to it compared to their other markets. For example, their European markets, which contain countries like Germany and the UK, The baby cereal that are sold in those markets do not contain any added sugar, whereas the same baby cereal sold in African countries contained added sugar. And whether or not, and there is no benefit for the additional sugar, even if you try to use the argument of certain countries having a higher rate of malnourishment. Adding sugar to the formula does not help with malnourishment. And so they had been accused of making the products for African country less healthy for infants compared to their other markets. And adding the sugar actually ran counter to the 2022 guidelines from the WHO, which warned that early exposure to sugar can create a lasting preference for sugary products and ultimately lead to obesity in children, which is very important to take into account. That's why I say it's really important for us to hold these companies accountable, because what the babies consume early in life can be so determining for their health, even as they grow older. So I hope that cleared up one area of controversy, and I hope you understand when I do say breastfeeding and breast milk is better than formula. But what really matters is if a child is fed. But formula is adequate to feed your child. It's adequate nutrition to feed your child. And and no mom or no parent should ever feel guilt for having to choose formula. And that's when we need to make the changes, how we treat families that choose or can't breastfeed for whatever reason. And people can't breastfeed for reasons like having breast cancer or, having breast surgery and or just their mental health. There's so many reasons that people don't take into consideration. Perhaps there's trauma in their history. There's so many things that we just don't consider that people do have to consider when they're making these decisions. And so I hope this shed light on why it is important for us to tell the truth, to the best of our ability, what we understand the truth to be, and not withhold information because we want people to feel better, because withholding that information may have a negative impact on the individuals. If we truly want women and their families to make informed decisions, then we must inform them of the truth. That was a hard one because I know this is a very sensitive topic for a lot of people, and a lot of moms carry mom guilt. And that sometimes is something that comes on that has nothing to even do with what is being said, but just how their experiences are being processed. So moms need to be supported regardless of their choice, but they also should be informed accurately. So let me know what you think in the comments. Should we not emphasize the fact that both are adequate, but breast milk is better? And the act of breastfeeding has some really important health benefits for women. Or is it more important to equalize them so that we are able to reduce the mom guilt that some people naturally feel when making the choice to use formula? And let's be honest, the mom guilt that a lot of women feel originated from public opinion to begin with. So perhaps if we change public opinion and we change the way we word it, that there would be less mom guilt to begin with. Let me know what you think. This is Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube and Healthy Bump Club on Instagram. I thank you guys for joining me today. I hope this has been enlightening, and I hope we can have discussions on other area of medicine where we are withholding the full truth and nothing but the truth so that people feel better, yet not be informed to make informed decisions. This is just one example. There are others. But as we continue in this conversation, I will be touching on just overarching overarching errors that are being made when it comes to our health and healthcare in general, so that we can have the foundation that's necessary to start out this year healthier than we've ever been before, and healthier and on our health journeys so that we are more successful as we go through this year together. So hope to see you guys on the next episode. This is Dr. T, just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.